Ways and Means joins us now. Congressman Greg Murphy, co-chair of the Doctors Caucus. Gentlemen, good to have you both on. Congressman Smith, want to start with you. You're going to reopen the government, it sounds like, in maybe the next 20, 30 minutes. Was this the most pointless shutdown that you have witnessed?
This shutdown was nothing but a waste of time. When you're talking about how the Democrats leveraged the pain of working Americans just so that they could try to push their liberal agenda. And what did they get? Nothing. They got the same offer that Thune gave them before there was ever a government shutdown. It's wasteless.
It certainly is. And staying with you just for one more, Congressman Smith, as far as what we saw today with Epstein, what was alleged today, how it was spun today, what your reaction to that?
Rob, absolutely ridiculous. They love to create drama. Let's think about this. If Donald Trump was in fact involved with Epstein in any way, the Democrats would have released that in 2016, they would have released it in 2020, or they would have released it in 2024 in one of the elections. But they didn't because there was no information. There was nothing that showed them being tied. It's just trying to create more drama.
Yeah, it was really, today was a really gross day. There's a lot of gross days in politics, but this was an exceptionally gross one. Congressman Murphy, wanted to talk to you because at the core of why the government just shut down for 40 days was because Democrats are so desperate to save Obamacare. It was all over Obamacare subsidies, demanding that the country continue to spend a fortune to prop up this horrible health care contraption that they have created under the 44th president. It's failing, and the one good line that I will say they have on all of this is that Republicans don't have a better option. Is that still the case, or is there an option in the works?
No, there's a whole lot better option, Rob. Look, the Affordable Care Act is nothing but affordable. This was written by insurance companies for insurance companies. The same things with the premium tax credits. So if you look at the cost of health care that's risen in this country since the ACA came in, it's due to two factors. Primarily, if you look at the cost of health care, look at the rise in insurance company premiums, and then you look at the rise in profits. Sure, medications are more expensive, hospitalizations are more expensive, but now the taxpayers are literally feeding the insurance industry machine, and that's what Democrats want this to continue to do. We don't stand for this. There needs to be absolute reform, and until this city really gets a hold of reforming the insurance industry, healthcare in this country will be unaffordable.
Elaborate more on that, Congressman Murphy. You want to change the insurance industry, and as far as the president's talking about giving direct cash payments to the people instead of these insurance companies, is that part of the forming plan that Republicans are going to have? Because they're going to need something, right?
Well, yeah, they're going to need something. But look at, Rob, in the ACA, 80%, it said that 80% of premiums had to go towards directly to health care, giving 20% for insurance companies for, quote, administrative costs and profit. Anytime an insurance company has millions of dollars donated to name a stadium while people cannot afford premiums, something is wrong. We need to drastically reduce the amount that is paid to insurance companies for administration for their profits and bring them in line with something that they produce a product that's affordable for the American people and actually pay the people who deliver the health care.
Let me give you just one more quote really quick. Congressman Murphy from Politico, a health policy guy in Politico today, says with direct cash payments from the federal government into special accounts, healthy people could get much cheaper insurance that has medical underwriting and doesn't cover pre-existing conditions, but that would leave much sicker people in the Obamacare pool and likely send Obamacare into a death spiral. What do you make of that assessment?
Yeah, look, the devil is in the details. Insurance in any industry, in healthcare or in the housing industry, oftentimes, or it has to be paid by people who don't use it to pay it for the people who overuse it. If people have chronic diseases, diabetes, renal failure, et cetera. There just needs to be a balancing out of that system. It needs to work for the people that it's supposed to work for, and that's the patients and the people who deliver the health care, not the huge, massive administrative burden and middlemen that has been achieved through the ACA.
Yeah. Congressman Smith, I got 30 seconds left. We're going to see a vote about how long from now? I just want to know for show purposes.
Roughly in about 30 minutes, we'll be voting to reopen government, to get people paid for the work that they've been doing as federal employees, to make sure that that working families that are relying on SNAP are going to receive those benefits as well.
Okay. Congressman Jason Smith and Greg Murphy, gentlemen, good to have you both on. Thank you.
Thank you.
All right. Matt Schlapp.